Aloha, Sonoma County. Here we are, coming to the end of January, and we're on Ask the Expert with Dr. Walter Tom, and we have
Hi, everyone. Karina.
Karina. Oh, are you like Prince now? You just have one name?
No, yes, one name.
One name, Karina. Okay, or like Madonna. There you go. Okay, so we have Karina, who is our surgical liaison, and it keeps me doing all the right stuff. And so, thank you, Karina, for being with us here.
Thank you for having me back.
And we have somebody producing for us here. Who do we have out there?
Yo!
There he is, Mr. Jeffrey Adams there. I love it, Maddie. We got the young Jeff, who is our producer and taking care of us today.
By the way.
Oh, you did. That's your middle name, right? Jeffrey Adams. So I'm the old guy in the studio, so I want to sound like his mom. Okay, I like that, Jeffrey Adams. So thank you. So again, welcome Sonoma County to our show, and for those of you in Maui who are listening to us on YouTube, Karina, we stream this into YouTube so that people can hear this as sort of our podcast.
Yes.
What have you been up to?
Lots of work.
Lots of work. Okay, good. I'm glad. I like that. That makes me happy. And so you, besides keeping me doing the right things and being our surgical tech and surgical assistant, what other role do you have at Dr. Tom Cosmetic Surgery?
Yeah, I do the surgical coordinating, so I help patients when they need to schedule surgery or they have questions about surgery needs.
So you're our surgical liaison.
Yes, surgical liaison.
That's a fancy word. Our surgical liaison. So thank you for doing that. So, patients, it takes a lot of courage for them to call, even more courage to show up in the office, right? But, the first step, if you're interested in some cosmetic procedures, is to give us a call. You're getting our listeners, by the way, thank every one of you for listening to us over the last 19 years now here at KSRO. And you can tell that Karina is just one of the nicest human beings that I know. And she's very knowledgeable on top of being nice. And she will answer your questions and help to direct you in the right way to whatever it is that you might have an angst about. So we talk about angst, okay? And people are calling in. Do you think is one of the more common concerns that patients have when they call you on the phone?
I think that most female patients, or maybe some male patients, the breast or the chest area is definitely an area that either they've been considering for a long time, or they were afraid, they never called, those kinds of things, or they just have questions. What if I did this? What if I did that? What would that look like?
That's right, and so take advantage of that if you would. There's not a charge for it, and Karina will set you up. What we'll do is, if you call our office, they'll set you up for an actual phone appointment with Karina, and she can go over things with you. And so breast is one of the more common cosmetic concerns for women, and you did mention men. And I know I want to do a show on that. We're not going to cover that today, but one of the biggest concerns that men, both young and old, have is gynecomastia, or where the male breast enlargement. And that's something that we deal a lot with. I deal with it as a cosmetic surgeon, and I dealt with it as a general surgeon. So I've been doing this for close to 40 years. And I know that men, when it bothers them, it's a significant problem, and we can help you with that. So just give us a call. We'll set up another show for that. And it's one of the more gratifying procedures for me, taking care of men, both young and old, who have that issue. Maybe actually, Jeff, maybe that'll be a show you and I can do together.
Sounds good.
All right. Yeah. And that would be great. So, Karina, in terms of breast cosmetic concerns that women have, what do you think is the more common phone call today?
Yes, I think that right now most women they've had implants for a while, and now they want an exchange, or they've gone through weight loss, weight gain, and they're wanting their breasts to be lifted, or they felt like they've lost volume, or their breasts are no longer where they used to be.
Right. Okay. So you mentioned lifting, a breast lift, and I have to say that it's been rather interesting for me that in the last 2 years we've gone from where we were primarily doing breast augmentation to now it seems like we're almost always doing breast lifts and breast reductions, either by removing patients' native tissue that it's too heavy for them, or as you said, maybe exchanging previous implants to smaller ones, or taking them out completely and doing a lift. So, when they call and they say, I think I need a lift, what kind of concerns is it when they talk about having a lift? What do you think is the motivating factor that's wanting them to contact
Yeah,
us?
so definitely they can say my breasts are too heavy or they don't fit in my bras. I have issues finding bathing suits, those kinds of things.
Right.
It's more, I think it's more of the one thing they always say is they're not where they used to be, right?
Right.
They've just drooped, they've sagged, and
They've
that
said.
is a big
Hmm.
concern
Hmm.
for a lot of women, younger or older.
Right.
So
Okay. So so we're talking about, so they've sagged. So
yeah,
what? So what?
yes.
I'll play the devil's advocate. So what seems to bother them that they're just saggy?
Yeah, they don't feel they say, I don't feel comfortable. They're not comfortable with their new breasts and the
Hmm.
positioning of them. So they
Okay.
don't feel comfortable in their tops. They
Right.
don't feel comfortable in their dresses,
And
right?
their
Maybe you
dresses,
want to wear a dress where you don't have to wear a bra
and the breasts are
and the
hanging
breasts
down.
are hanging down.
Right. So thank you for sharing that with me. And so I was playing the devil's advocate for
Hmm.
there. And I know that I've shared this story on KSRO Ask the Expert in the past. Back when I was a general surgeon and I did a lot of breast cancer surgery, and I was working with the American Cancer Society. I remember meeting with one of the young ladies there who was on the board, and we were just having lunch and talking about the American Cancer Society. And then she kind of opened up and relayed to me that she had had a breast reduction.
Hmm.
And that was back before I got into cosmetic surgery. And I even made the commentary. I said, why? Now I'll just call her Natasha. That wasn't her name, but Natasha, why would you do that? Why would you have an operation if you don't need it? And she kind of paused. We were having lunch, and she looked at me and she said, "You don't understand." She says, "You don't understand when your breasts are so heavy, you're laying down and they're lying down on either the bed or wherever you are, and that you have to take your opposite hand, grab your breasts, pull them up in order for you to get up. The neck strain, the back strain that's there,
Hmm.
the difficulty with that, besides the social implications
Right.
for a lot of women in terms of being too big,
Hmm.
okay? And it was really eye-opening for me. One of my favorite rock and roll lines, I'm an
Hmm.
old guy, Bob Dylan wrote it and the Byrds played it. It was, "I was so much older then, I'm younger than that now." And I try to live my life that way, is that, I was being judgmental back then.
Right.
And I didn't open up my mind to understanding being, in as much as I thought I was empathetic, I wasn't empathetic to the
Right.
concerns that she had described. And it was really a great lesson for me. So I appreciate that. And Natasha, if you're out there listening, you know who you are, not
Hmm.
Natasha. I want to thank you for educating me. So women are concerned that the breast hangs down. I think a lot of it is they're lying down and the breast hangs down under their arm, right?
Right.
That's one of their concerns. And another one that they may not put into words, but I will ask them, is that they are reluctant to get disrobed in front of their partner,
Right.
even because of their hanging down. They don't feel very confident. And one of the issues is they don't feel very feminine.
Hmm.
When the breast is hanging down over the rib cage, we had one funny patient who's really a sweetheart, and I remember her saying that her nipples were racing to her belly button, right? And she was really funny, but she was really just exposing her pain to us,
Right.
right? Her angst to us. And so that's really bothersome for the
Hmm.
patients. And what do I do, Karina? I'll see if you can guess what I'm thinking. We're evaluating them. They may be disrobed from the waist up off, and they're complaining of that. What do I have? What maneuver do I have them do in order to kind of see what they might look like with
Yeah,
their breasts lifted?
you ask them to just hold their breast up.
Exactly. Just say, put your hand under each breast and kind of just lift them up. And I tell them, not only look at where your breasts are sitting, is that where you want them?
Mhm.
But I said, look at the overall picture. Let your breast down, look in the mirror, because we have a three-way mirror. And I say, look in the mirror. And I say, pretend it's not you, and don't even look at the breast, but just look at the overall
Right.
body and look at that. And how old do you think that person is?
Mhm.
Okay. And then we have them lift their breasts up, and I ask them to, once again, to just say, how old do you think that person looks?
Mhm.
And it's amazing how much more youthful they look.
Right.
It's amazing how they also go from maybe looking heavier to looking healthier
Mhm.
by just lifting the breasts up. So that is, they're some of our happiest patients, right?
Right.
Is our breast lift patients. So if somebody's interested in possibly a breast lift, let's talk about two groups. Let's talk first about the ones who don't need a reduction. They
Mhm.
just want them lifted. What are the next steps for those patients? So a woman whose breasts have sagged to either breastfeeding, they're just older, maybe they have mommy skin from having babies and stretched out, now the breasts are hanging down. What is the next steps for those patients?
Well, the next step would be to, once they've called and they've gathered the information that they would like to know, we'd want to set them up with a consultation, a more formal consult with you.
Okay.
And then we would move into scheduling if that's how they want to proceed. Yeah.
Okay, so I'll meet with them, and I'll either meet with them virtually if that's their preference, or I'll meet with them in person. We always will eventually see them in person, of course, and we ask them to send in their photos, and when we can evaluate, so I can see if we're the right fit for them.
Right.
And then I spent quite a bit of time, about an hour, with the patient, going over what are the benefits of having a breast lift, what are the indications, and what other alternatives there might be, and we go through that with them. And so once we get that and we get them scheduled, and then we do the procedure, and we do everything under local, and of course you're in there with me, and you're helping me to do the procedure. What are the important parts that they should know about after surgery that they need to do in terms of taking care of themselves to get the best result?
Yeah, so definitely, recovery varies by patient, but we always say give yourself at least 2 weeks, right?
Right.
Where you're not rushing back into work or taking care of pets. If you have children, make sure you have plenty of help, because people just want to get back to normal activities. So you can set yourself for success by having those small details planned in advance.
I think that's really a good recommendation, Karina, because I tell people, if you take the time now to recover, you're going to recover way quicker than if you push yourself and then you set yourself back. Okay. In terms of taking off a couple weeks, that'd be great, especially if you do a lot of physical activity. But I will tell you, in terms of discomfort and so forth, after a couple of days, you're feeling pretty good. I think that most people, if they're off oral narcotic pain medication, that they could probably drive in 4 to 5 days. It's not what we're telling you to do, but you could. You certainly are up and walking around after a couple of days. If you want to go out to lunch with your friends, go to a movie, go for a short walk, a stroll, I should say, not don't turn on your watch to count your calories in your set. So you just go for a stroll. You absolutely can do that. So the recovery is pretty quick, but we want we do a lot of architectural changes to the breast to bring them up. It's just not a simple wave a wand over it. It takes a lot of surgical maneuvering to bring your breasts up and have them look good. And we don't want to kind of destroy all that work by not giving yourself enough time. So can you tell me in your words just how you see it, and maybe not so much the cutting part, but what are kind of the steps that we do when we do a breast lift? You didn't know that I was going to ask you about describing the surgery. That's my job, but I'd love to hear it from your words, because that might mean more to our potential patients.
Yeah, so definitely we get the patient comfortable. We get them as comfortable as possible. There is a little bit of a part where you're a little bit cold while we're prepping the area.
Oh, you're telling them everything. Okay, good.
Getting them nice and sterile for the procedure. Sterilization is important. But there are pinpricks in the beginning where the patient will feel, and we work with the patient. Especially you say, you're feeling that, you'll feel a few pokes. And the nurse is rubbing your head, and there's music going.
She's getting a head massage from the nurse.
She's massaging your head. And then, after the pinpricks start, the patient
the pinpricks, just so the listeners, the pinpricks are me injecting the local anesthesia. So I learned that from my dentist, my own personal dentist. The slower you move, the less discomfort you have. And I'm a total weenie, so I really appreciated that. And so we just take our time. You feel pinpricks local going in, but once we completely anesthetize you, then what are the next steps?
Yeah, we do a preliminary stapling of the skin to assess, how much you would like to remove. For the patient, we don't just get into taking everything off right away. Just measuring is important, and marking. We do a lot of measuring and marking along the way.
So I think a craftsman would say, you measure twice, you cut once. And that is actually how we approach that. So we do anesthetize the skin, and stapling sounds weird, but actually what we do is we staple kind of the skin together. That's what you're doing, is drawing the skin together to push the breast up, and it gives us an idea as to exactly how much skin it is. We mark off where those staples are, we mark the lines, we remove the staples,
Right.
and then we see the area of skin that needs to be removed. And I'm always surprised that when we use this technique, that I remove a lot more skin than I would have normally done if I didn't use this technique.
Mm.
Like, how much skin do I need to remove? And I'm
Mhm.
kind of using my surgical judgment and evaluating that. So it's a stapled tailor technique
Right.
that we use. So once we do that, we remove the excess skin. We push the breast tissue up superiorly. And one thing, just to try to describe it on the radio, is a little bit hard, but I know that people wonder about having a breast lift is, what do you do with the areola? Okay.
Right.
And that's not removed, put on the side table, and then put back on.
Mhm.
Okay. What we do is we leave it attached to the breast
Mhm.
tissue, or the breast, what we call the breast parenchyma, and we slide all of that up
Mhm.
together so it's intact. The areola is never disconnected from the
Right.
breast tissue. We move it up, and then we sort of suture all the skin back
Mhm.
together again into a new you, if you
Mhm.
will. And most women love
Mhm.
the result. Okay, so that's a breast lift. Okay, what it might be caveats that we're thinking about if a woman, let's say, has large breasts. Sometimes that's what they genetically were
Right.
born with. Sometimes it can be, unfortunately, due to weight gain, and of course the breast is composed in part of a fair amount of of fat tissue. What kind of items do we try to prepare the patient for ahead of time if we're going to reduce some of the breast tissue and do a lift as well?
Mhm. So we definitely want to ask the patient how much of a reduction they would like to have. So how much smaller. So it gives us a good idea of how much we are removing during the procedure. It's never perfect, but at least it gives us a little bit of a guideline to be able to do what's best for them.
That's perfect, Karina. So as you know, we can tell we've worked together for a while. That's what
Mhm.
we ask the patient. We're in the room, and they may be disrobed from the waist up off, looking in a mirror together with you and I. And just straight out, I'll say, how much smaller do you want to be? And let's not use cup sizes, because cup sizes are very inaccurate. But I may say to them, by a fractional, how much, do you want to be a quarter smaller, a third smaller, or use
Mhm.
percentages, 20%, 30%, 40%, 50%.
Right.
And sometimes we get women say, I want to be 50% smaller,
Mhm.
right? And then we kind of look at them, we look at their entire body. You
Right.
want everything to be harmonious. We will actually take out implants that we think, silicone implants that we have samples, and we might show them one of what they are, what we think they are, and then if they say 50%, we show them one
Mhm.
that's half smaller. Is this really how
Right.
small you want to be? And I would have to say that sometimes patients say, well, maybe not that much.
Mhm.
And then sometimes patients say, I think I want more off, right?
Right.
So it's really an individual concept. So we basically do the same thing with the lift,
Mhm.
but we're removing breast tissue. And so is there anything other than in the breast itself that people who come in for a breast reduction are concerned about? Are there any other parts of the body that they're concerned about?
Yeah, so a lot of women, the breasts and the armpit area can
Hmm.
sometimes, be together, and
Right.
it's hard to. They'll say, "I have a little bit of fat here," and they
Hmm.
point under to their bra fat area or under their armpit, and
Right.
that is part of the breast, but it's not really.
Not really,
But they're
right.
not really,
Right. So in their
yeah,
brain, cosmetically, it's just part
yes,
of that whole unit, even though it's not part. That is
right.
correct. So we call the armpit, as you called it, the axilla, the underarm, and the just below that is where a lot of times men and women can have accumulate fat in that area. So what we'll do to approach that, Karina, is that we'll, as a separate procedure, at the same time,
Right.
we'll actually perform liposuction in that area to help to decrease
Hmm.
that. Okay. So we don't go in there and actually cut away tissue, but we will
Right.
go in there under local, and we will liposuction that area.
Hmm.
So for some women, it's amazing. It gives them a great contour, and they love it. And then there'll be some women where it's fairly significant. We just had a patient that was like that, and I had to tell her that even if I lipoed that area, it still would be a lot of volume in
Right.
that area, and that really she needed to decrease her overall body
Hmm.
weight. And we're not being haters here. We're being supportive. We advocate for our patients, whether big, small, petite, whatever they are.
Right.
But we also need to be really forthright upfront with them, as we are with all our patients, and in terms of managing their expectations. Sometimes patients do need to lose weight beforehand in order to get the best result. And as an example, you mentioned patients who have had weight loss,
Right.
that sometimes their breasts sag more, and that's because the volume that is lost there, so the breasts sag more. It's the same reason that we want you to lose your weight beforehand, because we don't want to do a lift and have you lose weight and then
Right.
have your breasts sag some more. So all of these recommendations we are doing for you as the patient, advocating for you to get the best result. So Karina, we talked about the post-op recovery. We do have them wear a bra. How long do we have them wear a surgical bra for?
So mandatory 2 weeks, morning and night, and then after that they can switch to a non-underwire bra that they prefer. Some patients stay in their garment, and some opt to wear a sports bra.
So a garment's important to give them support. And it's really important. People don't realize that's a huge part of it. Okay. For instance, just for me, I had a total hip done. Okay. Right hip replacement. And I'm back playing hockey, so I'm excited about it, doing well. But a big part of it wasn't just the surgeon and it was his expertise, but was my rehab, my physical therapy. So that was probably equally as important. So things like garments are really important in this process. So we have them wear day and night, as you said, for a week. You mentioned a non-underwire. So what's the significance of that? Why not? Why can't I put an underwire bra on?
Right. Yeah, underwire bras can rub on the areas that are healing the incisions, and we just want to keep that intact. We want that to close nicely and not have something open for them.
You're really smart. Okay, so we don't want that to happen. So how long do we tell a patient that they can't wear an underwire bra?
3 months. Give us 3 months.
Yes. Absolutely. So I agree with that. And so we'll actually have them in a surgical garment, and then they can switch over. A lot of times we recommend a sports bra, but it can be a regular bra as long as there's no underwire in there. Okay, so we have them do that. Occasionally, especially in some patients where their breasts were really hanging out quite low, and it was a very dramatic move surgically to bring them up, or if they had a fair amount of breast tissue and we reduced them quite a bit and we brought them up. We have an additional bra that we have them wear. What is that called?
So it's called a Wowini. I don't know. I didn't give it. That's the company's name for it.
A Wowini. Okay. All right.
And it does give extra support under the breast area. Yeah.
And so we'll have them wear that as well, just to
correct.
Give them support.
It's on top of their other garment.
Fantastic.
That one can be a little bit tricky as far as how long. Sometimes we say 1 week, sometimes we say 2. Right. So really, it's just dependent.
That one's more on our clinical discretion.
Yes.
Okay. Well, Karina, thank you for being here again. We were talking about the angst of women with breasts which are sagging, both for reductions and just lifts. The processes, just give Karina a call. She has so much knowledge she can share with you, setting up a consultation with us, taking and helping you to manage your expectations and give you the best results that you can have. So I want to thank all of you once again for listening to us at the beginning of this 2025, and we're hoping to make this a great year for all of you. Thank you.